Hello again. Now we're going to finish up with our cranial nerves, so hopefully we don't have two really long videos, but we have two manageable videos. So the next video is going to be about the cranial nerves 6 through 12, and so this is cranial nerve 6, so VI is a 6 in the Roman numerals. This is the abductions, so abductions, so abduct, so think about what an abduct is. That's a movement. This is a motor cranial nerve. That means it moves something, and these are the eye muscles, and it moves the lateral rectus muscle. So think lateral, so outside, and so if it was to pull, that would pull your eye that way, so it would abduct your eye. So you would test it the same way you do with number 3. You're looking at eye movements. So what would happen if something was wrong with the cranial nerve 6? This is called a CN6 palsy. This is of the left side. Here's our left eye. And because remember, this is innervating the lateral rectus muscle, so it would pull your eye laterally. So he's trying to move both of his eyes to one side, and because this cranial nerve's not working, his eye won't go past the midline. So again, you would just test the eyes moving back and forth. So we've had a lot of nerves that innervate the eye muscles. Number 3, oculomotor. Number 4, the trochlea, and number 6, the abductions. They all are motor nerves that work to move the eye. And remember, your eye has a lot of movements. It can go up and down and side to side, and you can kind of do it all at the same time, make your eyes go round and round. So you need all 3 of these nerves to be working so that you can control all of your 6 eye muscles. Okay, the next one, cranial nerve 7. This is the facial nerve, and it is mixed. It has motor and sensory. And the motor branches all go out to the face, so they're used in expression. So you have nerves that go out to all your muscles that allow you to do different expressions in your face. And then sensory is to the anterior or front of your tongue for taste. So when you test it, you've got to test the sensory and the motor. And so a sensory would be a taste test. So you put something on the tongue, and if they taste it, then their nerve is working. If you put something that should be recognizable and they don't recognize what it is, and they should, then that could be a sign of some memory loss. So again, if they taste it, then the nerve's working. If they don't know what it is, then that could be some memory loss, some brain function. Motor would be symmetry of smile. This nerve innervates the zygomaticus, and so when you smile, it should be even. If both nerves are working, then you should smile evenly on both sides. If one's not working, then that side wouldn't smile. It would droop while the other side smiled. So a dysfunction, one of these is called Bell's palsy, and so you've got paralysis of the facial muscles. So if you look at someone and the eyelids are drooping, the face is drooping, the mouth is drooping on one side, then that means all of these facial nerves, all these roots, something's wrong, and they're not getting innervated, so they have a problem of the cranial nerves. It's called Bell's palsy. Now, you can also see something similar to this when someone's had a stroke. So you have to determine whether or not it's been a stroke brain function where you're not getting information from the brain to innervate and cause those muscles to fire, or is it the cranial nerve? But if it's the cranial nerve and you get this telltale drooping of one side, it's called Bell's palsy. And this is not always permanent. Sometimes it can come back because it's inflammation of the facial nerve, whereas a stroke, a lot of times that will be permanent. Okay, cranial nerve number 8 is the vestibular cochlear nerve. It's a sensory nerve. Some textbooks will show that it has a small motor component. For us, let's just go with sensory. We'll just kind of ignore that little small motor part for now. But the sensory part has to do with hearing and balance. And when we do the special senses, we're going to talk about equilibrium, balance, and hearing. And so to test this, you would do a hearing test. You would see, can they hear things on both sides, left and right side. The vestibular cochlear nerve actually has 2 sections, and one goes out to the cochlea, and the cochlea is the part of the ear that's involved in hearing. And then the other part of the nerve comes out to the vestibule, and the vestibule plays a role in balance. So if you've ever heard someone say they have an inner ear problem and they can't hold their balance, maybe it's actually something going on in the vestibule, or possibly it's the nerve. So damage to the cochlear part can lead to deafness, and damage to the vestibular part can lead to dizziness. So again, sensory for hearing and balance is number 8 vestibulocochlear, because two different parts, vestibule and cochlea. Cranial nerve number 9, glossopharyngeal. Anytime you see the word glosso, like glossary, it means tongue, so it's to speak. So glosso usually refers to something with tongue. Pharyngeal, we know what the pharynx is, the back of your throat. It is a mixed nerve. It does both. It has sensory and motor. Sensory is the tongue and the pharynx, and the motor is to the pharyngeal muscles. And so if you want to test this, a taste test would test the sensory. So again, can you taste something? And then the motor is the uvula position. So if you look in the back of the throat and look at the uvula or a gag reflex. So here's someone, this is the uvula, it's that thing that hangs down in the back of the throat. And so if you have a cranial nerve 9 dysfunction, this is a left cranial nerve 9 dysfunction. And this is stroke, and it basically has left it affecting the cranial nerve, the left one. And so because the left one is affected, the uvula is pulled toward the right. Okay, so that would be a cranial nerve dysfunction of the left cranial nerve 9. Cranial nerve 10, the vagus. X marks the spot. This is the only cranial nerve that innervates down to the rest of the body, below the level of the head and neck. So when we get into the parasympathetic nervous system, we'll be talking about the vagus nerve. When we talk in the second part of A and P, we talk about a lot of different things going on with homeostasis and control of visceral organs. We talk about cranial nerve number 10. So vagus 10, X marks the spot. Remember this one? It is a mixed nerve. It has a sensory portion and a motor portion. The sensory is from your thoracic and abdominal viscera, so the organs in your chest and your abdomen. Parasympathetic motor, it helps innervate the heart, the lungs, abdominal organs, so it helps control heart rate, breathing rate, digestion. You test it just like you test number 9. A problem with the vagus nerve, one of the things you may notice is a loss of your voice, because it's going to help your vocal cords, movement of your vocal cords, and difficulty swallowing. So loss of voice and difficulty swallowing can be a sign of damage to cranial nerve number 10. Almost done. Number 11, accessory nerve. The accessory nerve is a motor nerve, and it goes to the sternocleidomastoid and the trapezius. Okay, so this is going to two of your major muscles in your neck and back. And these muscles help you shrug your shoulders. And so the trapezius, if think about these muscles here, this part of the trapezius, when those contract, it pulls your shoulders up. And so you can put your hands on someone's shoulders and have them shrug and see if they shrug equally on both sides. And if they don't, that means one side is damaged. Because it's your sternocleidomastoid, actually rotation of the head can also be affected. So if you have damage, difficulty rotating the head, and shrugging the shoulders. So easily tested by having someone try to shrug their shoulders, and you can see there's a difference in the ability to do that. All right, the last one, number 12, hypoglossal. Hypo meaning lower or below, glossal tongue, so below the tongue. This is a motor nerve. It goes to the tongue muscles. So this is your hypoglossal coming out and going to the tongue. Number 12, and a test will be to stick your tongue out. So this is a cranial nerve 12 dysfunction. This person has a problem with the left cranial nerve, and the tongue is going to deviate to the left because the left side's not getting innervated, and that means the right side is dominant. So you look at someone's tongue and see which way it's pointing and figure out if they have a cranial nerve deficiency of the hypoglossal nerve. All right, guys, that is the end of cranial nerves. We've got a few more things to talk about with the nervous system, and I will see you in the next video. Thank you for your attention. Bye.